On to our next session, which will focus on the public policy landscape and what we can expect and need to pay attention to this year. It's my pleasure to introduce our esteemed colleague and moderator, Karen Grimsich, who is the Administrator for Aging and Family Services at the City of Fremont. So Karen, I am handing the floor to you. Take it away.
Thanks, Wendy. It's really nice to be together with 100 of us. It's been a long time, even though we're in a Zoom room. It feels good. And I do want to thank the Senior Services Coalition for bringing us together. It feels hopeful to be together talking about this. So this next session, well, I don't know about you guys, but it felt good to turn the calendar to 2021. It's still been a little bumpy, but it felt good. And so that's really what we kind of want to focus on in this next session. It's about the public policy landscape and really try to have a discussion around a realistic assessment of what significantly is going to change at the federal, the state, policy changes. What can we expect in 2021 and how will it impact our older adults in Alameda County? So we're going to be talking about a timeline. We're going to be talking about a roadmap of relevant elements with CalAIM, with the Master Plan and Aging. We'll have a presentation first. We'll be collecting questions just like we have been doing. So first I want to introduce the panel, and I want to jump right into the public policy landscape. And we're going to have Anissa Villarreal and Faith Battles from the Social Service Agency, and then Scott Coffin from Alameda Alliance. And again, I'll monitor questions. Thanks for the technology help behind the scenes. Again, Senior Service Coalition, you're the best. So let's just get started with, I think Anissa's going to kick it off and with the slideshow.
All right, well, good morning, everyone. Buenos dias a todos. Thank you, Wendy. Thank you, Karen, and the Senior Services Coalition for inviting us here to present. It's so good to be in virtual community with you today. As mentioned, my name is Anissa Basoco-Villarreal. I'm an Assistant Agency Director for the Alameda County Social Services Agency in Government and Community Relations. Some of you may recall I presented before you a few years ago regarding public charge when I was previously the Policy Director for the agency. Through my new role, I oversee the Policy Department, Contracts, Agency-wide Data, Information Systems, Program Integrity, known as Welfare Fraud Division, and the Workforce Development Board. Next slide. So today I will give you a brief overview of the public policies that are affecting or may affect our community. We will touch on COVID-19, 2020 federal legislation, healthcare, nutritional support, housing and homelessness, and then my colleague Faith Battles, the Assistant Agency Director of our Adult and Aging Services, will join me later in this presentation to discuss future opportunities and the California State Master Plan on Aging. Next slide. So throughout the last 4 years, we saw a number of administrative roles and actions taken in part to bypass Congress and to implement policy priorities of the Trump administration. Proposals generally follow the regular process of public posting, allowing time for public comment and considering comments, and then publishing the final rule. We did see some proposals bypass this process, and thankfully, some proposals have been delayed and enjoined by a court order. The rules and actions listed here are not comprehensive, but do highlight areas of concerns for older adults. Some rules are still in the process of being finalized, noting that some of them are pending on the slide. They have the highest chance of being rescinded by the Biden administration. They can stop the process and issue new policy directives for the implementing agency. Unless they are blocked by a court, policies that have been finalized are more difficult to change. Generally, it would require going back through the proposal and finalization process with an alternate policy. There are some options for Congress to intervene more quickly, such as to prohibit funding for the implementation of a policy or pass legislation to alter the law. And there may be the possibility to reverse some of the policies by executive order. Additionally, for policies currently engaged in legal challenges, the Biden administration could choose to no longer defend the policy in court. In Biden's release of his first day of executive orders, he directed a regulatory freeze memo. This will then pause any new regulations from moving forward and give the administration time to review the regulations that the Trump administration tried to finalize in its last few days. Next slide, please. In 2020, there were 4 COVID stimulus packages passed by Congress. 3 passed in March and the 4th in the end of December. The total investment is more than $3.5 trillion. The packages cover a wide range of services, from COVID-19 specific items such as free testing and support to public health agencies, to enhanced funding to social services programs and support to those who are homebound due to shelter-in-place orders. The major items in each bill are noted on this slide, with the items of specific interest for older adults highlighted in blue. The most reported items have been the $1,200 and the $600 of economic relief payments to individuals and enhanced unemployment and sick leave. But there have also been a number of investments in programs that provide access to food, medical care, and housing support. In the next few slides, I will dive in a little deeper into the major program areas. Next slide, please. The 4 COVID bills contained a number of items covering a wide range of public health issues directly related to COVID-19 and prolonged social distancing, especially for older adults who are at most at risk for severe illness and death. What's listed here is not comprehensive, but a few highlights related to Medicaid, Medicare, and long-term care. Next slide, please. The 3 federal stimulus packages offer a combined $1.15 billion for senior nutrition programs, including home-delivered meals nationwide. The CARES Act clarified that individuals who are homebound for social distancing purposes are eligible for home-delivered meals, regardless of other eligibility criteria. In Alameda County, we piloted the Great Plates Delivered program, as discussed earlier by Pete, and it was established through our agency with strong support from the Emergency Operations Center. Funding from the FEMA Public Assistance Program provided 75% federal cost share for this program. Since late May, the county served nearly 900 eligible seniors through our local program in Alameda County in partnership with 65 small and local food providers and restaurants. In addition, our agency through CARES funding dedicated $46.4 million towards emergency food distribution through issuing an RFP. That purpose of our RFP was to serve homebound older adults, youth, medically vulnerable individuals, and individuals that were experiencing hunger as a result of the pandemic. As of January, 27 proposals were submitted, 22 contracts were awarded, 1 was incomplete, and 4 were not awarded. All contracts awarded were extended through the end of February. Last, the Supplemental Nutrition Assistance Program, known federally by SNAP, or locally as CalFresh, those benefits are increased to the maximum monthly allotment per household size. The benefit enhancement is not ongoing, but is extended each month. The SNAP or CalFresh benefits are increased by 15% for all recipients for the first half of 2021. Next slide, please. California issued a statewide eviction moratorium only for tenants who cannot pay rent because of COVID-19 related to financial impacts. California's moratorium was set to expire on January 31st. Yesterday, state legislators approved SB 91, extending the state's partial eviction moratorium through the end of June and creating a program to distribute $2.6 billion in emergency rental assistance that California received through the coronavirus package that the federal government passed last month. Alameda County's eviction moratorium expires 60 days after the local emergency is lifted. In the local ordinance, tenants have up to 12 months to pay back due rent. If a city in the county has an eviction moratorium ordinance, the city ordinance can prevail to the extent that the ordinance is more protective for residents. Next slide, please. This slide gives you a quick glance at many potential opportunities for advancement through the Biden administration, ranging from COVID legislation to increasing Social Security benefits to expanding Medicaid, Medicare, and increased funding through the Older Americans Act. One overarching opportunity with the Biden administration comes from an executive order released on his first day as president. the launching of a whole government initiative to advance racial equity. The order begins the work of embedding equity across federal policymaking and rooting out systemic racism and other barriers to opportunity from federal programs and institutions. We heard a little bit about this through Kimmy and Kevin's presentation earlier, so I'm so glad that we are continuing in this alignment. Two glaring opportunities are the $1,400 economic payments and the $15 minimum wage nationwide. The economic payments would allow for an additional $1,400 per person in direct checks, with expanded eligibility to adult dependents who have been left out of previous rounds of relief and all mixed status households. The Biden administration proposes to raise the minimum wage to $15 an hour and end the tipped minimum wage and sub-minimum wage for people with disabilities. Another opportunity for advancement is through the Older Americans Act. The funding for the Older Americans Act was reauthorized by Congress and signed into law on March 25, 2020. Reauthorization is effective through 2024 and includes a 7% increase in 2020 and a 6% increase per year for the next 4 fiscal years. This results in a more than 35% total increase in program funding over the 5-year reauthorization period. In Alameda County, 77,000 individuals were served through AAA programs in fiscal year 1920. I will now hand over the presentation to Faith Battles, who will lead us into a discussion on challenges and opportunities she sees for us at the local level.
I'm Faith Battles. I am the Assistant Agency Director for the Department of Adult and Aging right here in Alameda County. We're responsible for satisfying the needs of individuals that are aged, blind, and disabled. So I will add a little bit onto what my peer Anissa said that makes it more specific to Alameda County. In terms of challenges that we're facing as a result of the pandemic and the current economic environment, we have several. One of them is food insecurity. If you noticed in Anissa's previous slides, 3 of the 4 federal legislation bills that came out had a portion of senior nutrition or nutrition programs embedded within it. That speaks to how serious it is that individuals throughout the country, especially our older individuals, are suffering to not have enough food to eat, enough nutritious food to eat. So we're making sure that we try to address that. Since March of 2020, our Area Agency on Aging, which has contracts to serve seniors, one of them is senior nutrition, we've served about 130,000 older adults, over 130,000 older adults, and that has equated to almost 700,000 meals. So that'll let you know how serious the food insecurity is. Seniors have relied on that before, and it's even more so now that those seniors that were a bit more able to get out and go to the grocery store on their own, they are compromised a bit more because of the very serious stay-at-home order for them. The second challenge is social isolation. I'm preaching to the choir. I'm sure everybody knows about that. Everybody is experiencing some degree of social isolation, even more so for the seniors. Just having to be very, very careful about who you let in your home, who you go around, because you know that you are greatly at risk. In terms of older adults, the social isolation is even more concerning because it can lead to depression and loneliness. That's a really big risk factor for older adults, because as you get more lonely, you can have thoughts of not wanting to continue to be in the world. You can have thoughts of not wanting to be more active and moving around. And also, without having to connect with other people socially in the way that we're used to, you wind up having some types of declines in your cognition, how you understand things, and even in your physical health. I worry about seniors falling at home because they're socially isolated, having minor injuries that turn into big things because folks aren't around to watch them and notice that something is wrong. The third challenge that we're having is the digital divide. We all know what that means. People are talking about it today. I can't see the slide. I had a hard time getting on, so I'm calling in. All that means is everybody in this country, seniors in this county, don't all have the same access to the internet and technology. We've gotten very modern as a country, and it's so convenient, but everybody is not on the same page around that. So whether it is about you don't have internet access in your home, either the facility doesn't provide it or you simply can't afford it because it's expensive, you do not have a smartphone, or you don't have a tablet, or you don't have a computer to be able to even get on the internet, or you don't have the comfortability and the skills to be able to navigate the internet. It's an amazing tool, but it can be very, very challenging to understand. And there's risk with getting on the internet because there's all kinds of scams. So that's a challenge. The next challenge is housing insecurity. We talked about that in the very beginning with personal testimonies about older adults that we know who have struggled to be secure in their housing, whether it is because of the eviction possibility that are coming up, or even some people that are living with other folks in crowded housing as seniors, which creates a big risk for anybody in the light of COVID. Another challenge that we have is sufficient income. Seniors do not have enough money. That is a part of the master plan, wanting to age affordably, not having sufficient income. We know that there are some of you that are older adults that actually had employment. You worked a little bit part-time, but with the very, very strict stay-at-home order, you had to kind of work in-house or not work at all. Of course, disaster preparedness, making sure that everybody is aware of what they need to have in their home, who they need to get in touch with, their plan in the event of a disaster. And now we know a pandemic is a disaster. And lastly, the vaccine distribution and injection. We're running short for time, Karen. So next slide, please. The biggest opportunity that I would like to highlight is the master plan on aging. That's what the state has created to give a bit of a framework, a flexible living framework for all of the counties to be able to access, that has 5 goals. And I'll tell you those quickly. First is housing for all ages and stages. The second is health reimagined. The third is inclusion and equity, no isolation. The fourth is caregiving that works. And the fifth is affording aging. Underneath those 5 bold goals, there are over 100 two-year initiatives that the counties can take hold of and dig into to try to bring about those bold 5 goals in those particular counties. So I'll stop, Karen, and see if you want to go ahead with the question and answer so that we can hear. I
think we're going to roll right into Scott Coffin.
Oh, I'm sorry, Scott, you're next. Okay.
But I do want to remind people to put questions in the chat, and we'll get to as many as we can, and we will follow up on all of them. So, but thank you, Scott. But we'll switch to his slides. Yeah, thank you.
Excellent. Good. Thank you.
Good job, all. Thank you.
Okay. Thank you. All right. Good morning, everyone. My name is Scott Coffin, and I'm here representing Alameda Alliance. And I want to start by thanking the Senior Services Coalition, Wendy Peterson and Karen and the team here for the opportunity to be part of this event. So thank you. I'm going to go ahead and jump in. I have a limited time, I'll say, to talk about a lot of information, but this is my hope is that this is a starting point, that it'll set up for future discussions as I think everyone is talking about the health policy changes that are contained inside the governor's budget. This slide here just highlights a couple of the major points. There are many in the budget, but the funding that is being centered around the CalAIM program over the next 5 to 6 years. And I know we're talking today about what's happening in 2021 because there is a lot of change that is occurring right in front of us, that's right around the corner. And then there's also some longer term change. And so this presentation has some longer term information and also some reference materials for those that access it online. There is an appendix with information about what I'm talking about, the enhanced care management benefit or target population, the in lieu of services, as well as a timeline that is proposed for Alameda County that goes from 2021 all the way through 2026. And so that's there for you as a reference. If we could advance to the next slide, please. So we have some really important questions that we need to answer in 2021. And the first, which is right in front of everybody, and really I think impacting everybody here that resides in Alameda County as well as every other county in the nation, is the COVID-19 vaccination. And the question there is, how do the vaccinations play into or impact the planning efforts for this year? There's significant policy changes that are coming from Sacramento. And what do we do to ensure that the disparities are minimized and that we keep equity in the forefront as we're thinking about all of these changes, because these changes require extensive community-based planning. It's not that there's one organization or one person that's involved. This is many people involved. You know, so shifting over to looking at the capacity of the county, you know, one of my concerns is really preparing for these changes, in particular with the whole person care transition and the health homes program transition. Both of these are very meaningful and important programs that many of us have invested years of time, and we've had thousands come through the programs and be helped through the waiver extension that goes all the way through this calendar year. We have to prepare for next year in 2022. And the question that often comes to mind is, what is the capacity of our delivery system? Do we know what our capacity is? How do we scale that capacity to serve more people? Again, as this program changes at the end of this calendar year from where it is under whole person care and health home into the enhanced care management target populations and the in lieu of services. And again, if you want to look at what those services are and the target populations at the end of this presentation, there's a full definition of all of those, both of those components. One of the things that CalAIM requires is extensive encounter reporting and also tracking of the patients that are part of these services. And another question, an important question, is really around the delivery system. Are we ready with the infrastructure to participate as it's outlined in the CalAIM proposal? And I point us over to encounter reporting because a lot of times the encounter reporting is tied to how we submit claims for reimbursement. But there's more to it in terms of the patient interaction and how information gets recorded about who is taking care of this patient along their pathway, you know, of care. Because as we know, many of us here on this call are supporting folks that are in the Medi-Cal program, but there's different parts that we all take in that process. Some are more social based interactions, and some are medical based, mental health, substance use. And so as we think about what whole person care means and how we transition from the whole person care program and the health home program, we need to think about how we're going to track this information and how we're going to record it and prepare for audits that come in the future by the state, because part of the linkage with the encounter reporting and patient tracking is the requirement on the audits. So the question around coordinating transitions of care, and I think we've all learned of some of the barriers that we faced in the whole person care initiative, the AC3 program, which has, by the way, been one of the state's performing programs that has really stood out. And one of the things that has stood out to the state is that we have many of our community partners working together in this program. One of the barriers we have identified as we moved forward was the legal barrier around sharing data. And these are things we need to work out or find workarounds to actually manage, because coordinating transitions of care requires the sharing of data and access to this data. And again, it goes back to that earlier point on infrastructure and readiness. Do we have what we need in terms of resources, infrastructure resources, to share this data? We need to inventory where we are this year in 2021. And that besides the planning, taking note of all of the resources and the status of where each of our caregivers are currently today is a major step this year. We have time to do that, but the time is going to move quickly, as my time is quickly diminishing here. So we'll talk more about this at a later point. And then the last one is, how do we work together to really work through the eligibility criteria and the service thresholds? This is the detailed part of what's inside the CalAIM proposal around the enhanced care management target population and the in lieu of services. We have to be very specific about setting values and limits on these services, and then defining how we track that number of service or number of services that get offered to an individual. And this is goes back to the infrastructure and the inventory work that we need to do. Okay. And then lastly, I'm going to close on the next slide quickly and I won't read through every one of these lines here, but this outlines from a time perspective some of the key activities. In February, March, and April, we are hosting a series of listening sessions. And one of the first ones we're going to start with. The Age Friendly Council, of course, volunteered to be one of the first Senior Services Coalition members. We are going to have a listening session and planning sessions. The listening sessions are really to understand about the inventory and what's in place and for us to get it documented in one place. And the planning sessions are about playing that information back and talking about, okay, here's what enhanced care management target population could look like, and here's the in lieu of services that we could focus on that we're capable of actually implementing. Another key point, since we are a two-plan county for Medi-Cal managed care, is we would be partnering with Anthem and Alliance so that we would have one table to sit at versus having two tables. It really makes a lot of sense. And we learned in whole person care, it was more meaningful to have the managed care providers and administration all at one table doing the planning. So with that, we are going to develop a transition plan by July, and that's a big undertaking. We don't know what the rates are, but we're going to have to move forward anyways with this planning and development of a transition plan as well as a model of care. And then in September, the provider network submissions. So, and then October, November, and December focused in on just operational readiness steps. So with that, Karen, I'll pass it back to you. Thank you.
Yeah, thank you. Thank you to Anissa, Faith, and Scott. I mean, we are so fortunate to have leadership like as you guys that's approachable and open. And what I hope everyone in this Zoom room heard is that they're looking for all of us working on this together. This really is going to take the input from people who are directly providing services, administrators, all of us. So having one of the questions in the chat was around, what's our particular things in Alameda County? Well, that's for all of us to decide and work forward on. We have the master plan, we have CalAIM, we have a lot of good opportunities in front of us. And now let's really try to make a difference in older adults' lives. So we're going to, instead of going through the chat, you're still welcome to type things in and they will be followed up on, but we're going to go to the Jamboard and try to collect input via the Jamboard.
Thank you, Karen. I just want to give a round of applause to Karen and our presenters, Anissa, Faith, Scott. Virtual round of applause. Really very much appreciate the information and the knowledge and expertise, and also the focus on county that you're bringing to us. So it's time for our next Jamboard session. We can stretch and enter our answers to the following question into the chat. So our Jamboard question is, we've heard about new public policy that will define the landscape of 2021. What are your key takeaways? And what requires engagement or action? And again, as Karen said, we'll be capturing all of your questions that you had for our speakers, and we will be responding to them in the next week or two with the conference proceedings. We're also going to be gathering all of your answers to this question. So what are your key takeaways from this last session, the public policy landscape? What requires engagement or action? Type your answers into the chat. And, you know, while we're waiting for people to type, because it does take a little bit of time, doesn't it? I think I'll ask Karen and I'll ask Quayle if you have a, you know, really brief key takeaway. And Karen, you're muted.
Yeah, and we didn't, you know, talk a little bit about stakeholders engagement, but we really didn't talk about the, you know, specifically about the addressing inequities, which is what we've been, I mean, we've been pulling that out all morning, but how do you see, I guess start with Scott's CalAIM trying to be inclusive? Any particular efforts?
Yeah, thank you, Karen. And one of my takeaways is I'm reminded how important it is going to be for us to remain collaborative. There's a lot going on and a lot of moving pieces, and we have some intersection amongst, our either from local government to statewide, and then some of the federal considerations. And so I think that it's just a good reminder to us that there's a lot of overlap and that we have to stay mindful and keep our collaboration and coordination all lined up.
And inclusive with the older adults themselves, which again ties into that digital divide and us, being, the door-to-door kind of community organizing that's needed when we're trying to really make policy changes at this level. So we have the leadership, we have everyone in the room, but we really need more people. So I don't know if Scott or Anissa or Faith, if you guys want to address anything. There's also some questions about older homeless individuals and how we're going to bring them along with CalAIM.
Well, and one thing, if I can chime in here, Karen, in terms of requiring engagement, especially as it relates to the federal level, when any public comments or the Biden administration is looking to change any administrative changes, that requires public comment. And so I would just encourage the coalition, and my team can be engaged, and I know is engaged quite a bit with Wendy and Faith's team. As public comments are opening up, we'll make sure to share with you all so that the public is engaged in that process, because it really, the federal government depends on the public comments to decide and to sway in which direction they are going to decide for administrative actions.
And the efforts that make sense in Alameda County are dependent on us making this right for Alameda County, right? So that takes the conversation. We're dealing with feds, we're dealing with states, you guys are our local leadership, but it really has to meet our needs.
Right, and absolutely, and as Pete mentioned earlier, we're highly dependent on federal and state funds, and so it all connects locally.
A lot of community organizations, I'm just reading some of the notes now, and in the chat in the Jamboard here, community-based organizations are on the phone that are providing a lot of long-term services and support. So I think Scott mentioned that a little bit, but he is looking for more input. The Senior Coalition will be facilitating more input from community-based organizations.
Yeah, and Karen, I just chime back a note, but a quick mention that, all the work that the community has done together to build up the whole person care model, the housing and homeless problem certainly doesn't go away. It's actually been more, more clear, I think, to all of us that we need to really focus in there and address that as part of the work that we do in 2022. Again, the more we can inventory what's happening this year, it'll help us to crosswalk that into these future services that we're planning for. So it's a big part of it.
Okay, Wendy, I think, did you want to go over the Jamboard some? It is reiterating some of the conversations that we've talked about, the inclusivity, the digital divide, opportunities, all of us working together.
Yeah, and actually my view doesn't allow me to see it well enough because I'm running the slides, so it would be great if you and Coily can read off a few. We do have a little bit more time before we move on. We've adjusted things on the back end, so I think that this input that we're hearing is really important.
Yeah, I'll read a few, Coily, maybe you can pick some too, but
Karen, if I can also respond to when I think Sally asked a follow-up question around public engagement and how it can happen. I just wanted to kind of follow up and say that there is a variety of ways that the public can be engaged at the local level. One is always uplifting any either state or federal policies that you want us to take action on. Our agency can bring forward a recommendation to the Board of Supervisors to take a position, either support or oppose, depending on what the policy is. So always welcome the opportunity to hear from you. If there's any policies that you want the county to take a position, please let us know. Those opportunities are always available to you.
I'll read a couple, Wendy, and thank you, Anissa. But you know, concern around when some of the emergency funds that we've had, you know, the CARES funding, and you know how we're going to transition from that funding into what it's going to look like, you know, after that. So a lot around sustaining efforts that are being created now.
Right, and I'm seeing here, and I'm sorry, but it's like super tiny on my screen. The need for the engagement regarding building more affordable housing, and also for I'm also noticing that housing is coming up quite a bit, but also listening and planning sessions and guidelines and dates are very, I think it says very important. And I actually want to emphasize that, how important it is that we make sure that we are listening and making sure that the people who are impacted by these issues have the information and are able to seamlessly participate without having to deal with challenges around understanding how they can engage. So that's a big one.
The other unique thing, I feel it's a big thing we talk about in Alameda County is just geographically how spread out we are, and the looking at base services being available throughout the county, not just service-rich areas that tend to have more concentration. And that's a big challenge, right? So that we're making sure that when we are rolling out or we're looking at in-lieu services, that they're offered throughout our large county.
Right, and there's one from Lisa, resources for older adults who aren't able to maintain their homes. Yeah, so I think it's probably time, and so I think we'll continue to capture your answers to the Jamboard question and populate the Jamboard. So you'll see all of your answers up there on the board that we take a picture of. I'm going to move on to the next session. I want to thank Karen. Thank you very much for helping us with this wonderful transition and being able to really listen to the community. And thank you to our panelists.